Well, thanks so much, Kendall, for that lovely music. I appreciate everybody here today. I know we're going to have quite a few more probably pop in and out as we go. So just some housekeeping things before we really get started and dive in for our webinar here today for the shop method. I wanted to make some introductions before we get started. If you are new to Livestorm, there is a chat section down at the bottom of your screen where you can pop in. Again, a lot of you already have, but we're going to have some moderators join as well. So if you have questions as we go or would like to chime in with a comment or something to contribute, you're more than welcome to do that through that chat section. Please feel free. And then again, we are going to have a couple of moderators on the chat section to answer some questions, either if you have some directly for DocStation or just in general. We'll be happy to answer those as we go. There is also going to be some time at the end that we can answer some questions and go through some things as well. So feel free, pop that into the chat section, use it as you need to. And then we are going to go ahead and, again, make some introductions on our side and get us started into the shop method today for our vaccine webinar. So in just a second, I'm going to go ahead and share the screen here. Again, I see a couple of you guys that I recognize in the chat, so that's fantastic. We should have quite a few attendees today, but the session is recorded and will go out afterwards as well. So if you would like to have anybody else join in or listen in, you're more than welcome to do that, but you'll get a copy of this recording too. All right, so with that said, I'm going to share our screen here today and probably make a few extra introductions as we go. All right. We're going to go ahead and get started. Please bear with me. Again, sometimes technology has a fun time here. All right. There we go. All right, everybody. So it's time for us to go ahead and get started. My name is Rachel Matz. I lead our clinical solutions team here at DocStation. Joining me today, I also have Dr. Angelina Tucker, who is with Best Value Pharmacies out of Texas and is also the MNF for CPSN Texas. I asked Angelina to join us here today. Thanks, Angelina. Hey, she is actually a current DocStation user as well, but also just really good in her experience and can give us some insight from the pharmacy's perspective. So we'll be kind of having an open conversation. We'll be talking through a lot of different opportunities for increased reimbursement, obviously through vaccines as well. But I did want to give and have the opportunity to share from Angelina's perspective in her pharmacy as well. So thank you so much, Angelina. I really appreciate you being here with us today. It's been awesome working with you, obviously, the last couple of years, but I'm super excited to have you here with us today.
Definitely. As we can see in the chat, Rachel is the best. I would definitely agree with that.
Thank you so much for that. Appreciate it. No pressure here, right?
Our relationship over the past, few years working together, just on medical billing, just DocStation, it's been really great, and it's really helped to support a lot of the activities that we have going. So thank you.
Yeah, no, thanks for that. Appreciate it. So again, a couple of housekeeping things for setting an agenda here today. What we're going to discuss is the shop method with the intention of being able to help find additional or hidden revenue in vaccine billing. And so what we're going to talk through are some options in really dissecting this concept of medical versus pharmacy benefit when it comes to unlocking that higher reimbursement for vaccines. With that, what we want to accomplish, what things we want to achieve here is being able to have a 95% or higher first pass acceptance rate. So we're going to go through a couple of things as far as this agenda is concerned, but I also want to make sure that everybody knows where to access. There are going to be a couple of poll questions that'll be posted throughout the call today. So if you're looking for some interaction or things to keep up with, there are going to be a couple poll questions. I think actually a total of 3 maybe, but as you see those come in, no pressure there to answer them, but they are going to be interactive. So please go ahead and feel free to answer those poll questions as they come through as well. So first and foremost, what is this shop method? And so we're going to break each one of these down in more detail as well, but being able to search for that hidden opportunity. What are those additional billing opportunities that you have? And then being able to harness better reimbursement on the medical benefit. And I'm really going to hone in on this section quite a bit as well, being able to capitalize on higher reimbursement through the medical using a platform like DocStation. Being able to optimize your claim submission operations with, being able to manage your reimbursements and being able to track everything as that T section, goes through with track and adjustments for any of your claims in real time. All of that is super important to make sure that it is optimized and that you can track any of those reimbursements internal as well. So we're going to break each one of these sections down, and we're also going to touch a little bit on implementation within your pharmacy and what sort of solutions you currently have, or maybe what you're lacking. So we'll talk through all of that today as well. Okay, so first thing I really want to break down is kind of this historical concept and really look at the traditional way of billing vaccines, and then have that comparison, break that down into the DocStation way. So there's this myth around vaccines that it is, you can only bill it one way. And when I talk to pharmacies every day looking for those clinical solutions, and in particular with independent pharmacies, where there's this concept, there's this idea of, again, only being able to bill one way for vaccines. And that is when you bill through Medicare or Med Part B, you have a bin within your dispensing software, you get that rejection, and then you turn around and bill that back to the PBM or to their Part D plan. One of the things that we're going to go through here today is looking at the concept and looking at the difference between what is traditionally thought of as the Part D plan, that PBM, and looking at what the medical benefit would be for that advantage policy. So oftentimes when I talk to my pharmacies, and maybe Angelina, you can chime in on this as well, but oftentimes when I talk to my pharmacies, this concept of, or this idea of the advantage policy, it's only the Part D plans, but that's really not it, right? That's not the only thing here to consider. When you look at an advantage policy, there is medical benefits under that advantage policy. So what we are recommending, and the DocStation way here, is to be able to bill Medicare. You would still might get that rejection, right? So it'll come back in your dispensing software. You'll get that message pushed back through real time because eligibility is run. But you'll get that message back, pushed back into your dispensing software to tell you which advantage policy that patient has. And then instead of billing that to the PBM, you need to turn around and bill that to the medical benefit on that advantage policy. So whether that's Aetna, Cigna, Humana, Blue Cross, all of those things are what we want you to consider as that medical benefit. And again, you can do that straight through your dispensing software. It's the same bin. It's a different PCN because it's a different payer than just your traditional Med B, but it is still a medical claim. And so we're going to talk about how do you see higher reimbursement on that medical benefit versus going back through their Part D plan or that PBM. And so I think it is really important to break that part down. And maybe, I think the first poll question was posted there as well, but it's really important to be able to understand what those challenges have been, but then also how do you kind of switch that mindset from the traditional way of thinking of always going through the PBM once you get that rejection to now maybe I should be billing this as a medical plan or as a medical claim. And how do I do that? So we're going to talk through a couple of those options as well, and making sure that you guys can really understand how that process would look and how you might adopt that within your own pharmacy. Angelina, do you have, maybe any kind of feedback to give on when you see claims coming through Medicare B, vaccines in particular, and then maybe what that, the traditional mindset, right, of, oh, well, now I don't have an option, I've got to go back to the PBM. How hard is that really to kind of shift that mindset, I guess, maybe within the pharmacy to really go back towards the medical benefit?
So I think it's just a workflow process. It is shifting mindset for sure, but I think within the pharmacy setting, everything is very much workflow process and streamlined in terms of prescription processing. So you hit an obstacle A and your pathway is C or D. And it's very much routine. So essentially, if you hit a roadblock and it is rejected, then knowing what that pathway is in order to bill the Medicare Advantage instead of the PBM. And it goes back to things like training, training your staff, understanding that if you do hit a roadblock, if you do hit a rejection, then this is the pathway that you choose. for me, it's always come back to training my staff, educating my staff, having a staff meeting, letting everybody know what is the process, and then being able to follow through on that process consistently. And then once you have that, just like prescription processing, you bring the script in, you type it up, everybody knows very clearly what to do. And I think if that's communicated, if it's trained to your staff and what that pathway is, then it becomes part of the routine. And then obviously having somebody in the back that's checking on that, right? So, you know, in the very beginning, when we started this process, we did have a pharmacy technician that helped us with that. You know, you want the pharmacist focused on the pharmacist, the cognitive skills, but we want to, you know, support our staff and our technicians to be able to do alternative roles other than just filling prescriptions. And one of those roles can definitely be revenue cycle management, can be in the back end, especially if they're not that great with speaking with customers, or they don't want to be on the front lines, you know, having someone on the back end that's looking over those claims to catch those dollars that are just, you know, that's on the table. You absolutely need to have that person focused on it, and increases your ROI as well if you can train a technician and have them focus on this.
Yeah, no, that's great feedback. And I think it's important to understand when you're looking at your pharmacy dispensing software, the information that's pushed back. So when you bill a claim, and for everybody here, Angelina's on Liberty, or their pharmacy's on Liberty, but I know that obviously the countless opportunities or the countless things that you have as far as the dispensing software, but the information that's pushed back when you have that initial eligibility check run at point of sale, when you dispense or when you administer, you need to know right then that that patient has an advantage policy, and it's important to understand which advantage policy they have. So making sure that, you know, a system, DocStation system, is able to push that information back to whether that's the technician or whoever's actually going through the dispensing software and submitting that claim through the dispensing software, and they understand, now this is an Aetna Advantage patient. I need to go use still in Liberty, but I need to bill this claim to Aetna Advantage for my vaccine, not CVS Caremark or Express Scripts or, you know, Optum, but the medical benefit. And so those instructions, having that pushed back into your dispensing software, just to be clear and transparent, is also extremely important. So when you're going through and training staff, it's really, you know, the opportunity that you have is to be able to say, this information is clear and transparent, and it's posted back into your dispensing software. You know exactly which claim or which plan you should bill this to. And again, kind of coming back to getting out of this rut of the traditional route where everything is routine and they go back to the PBM. Nope, we want to make sure we stop in place and go back to that medical benefit. And DocStation system is going to be able to tell you which medical benefit to bill to. And that's really great and convenient as far as helping out with training as well.
I think also once we get that rejection of capturing what that medical benefit is, being able to put that into the pharmacy management system as well. So it's captured and it's there for future use is also another key training point as well.
No, that's great feedback. You know, and a lot of times dispensing softwares have that medical tab that you can store right then and there, being able to collect, hey, I see that you've got Aetna Advantage. Let's go ahead and load Aetna as your medical plan right there in the dispensing software. And then again, it's just face-to-face time with that patient, making sure that you're collecting all that information at that time. Yeah, that's great feedback. I think it's really important for us to also make sure that we have the data to back this up. So when, you know, DocStation is, you know, we all hear this, you know, bill to the medical, but why should we do this? And it's really important to be able to back this up with data. And so one of the things that DocStation was able to do is be able to show you the numbers. And this is aggregated data, almost 30,000 PBM claims to, you know, a little over 10,000 medical claims. But this is internal data that we have gathered to be able to show you the actual benefit of billing to the medical plan. And what this is, just to be clear here about where this data is coming from, these are Part D plans, and then being able to compare that against the medical benefit for all of these vaccines. So when you're looking at the PBM of 139 versus 245 on the medical, this is the comparison between the reimbursement that you're getting back on the PBM Part D plans to the medical benefit, whether that's Medicare or Humana or AARP or United whatever that advantage policy is, but as a medical claim. So I want to be clear here about the difference, and it's really clear why you should start billing to the medical benefit, right? And these numbers are just, obviously a smaller sample here, but you get the idea, you get the picture about why this is so important and why it's so valuable, and how much you really do stand to gain to be able to increase that revenue. And of course, the being able to dissect and find that hidden value is really what we're trying to show here. One of the other things that's not necessarily displayed on this screen, but is something that I want you to consider, is looking at that incentive fee. And when you look at that incentive fee, whether that's to a PBM for a commercial plan or to even a Part D benefit, but Angelina, I wondered if maybe you can just kind of give some context around the incentive fee. And I'm sure you've seen it and everybody here has seen it, but how many of those PBMs don't pay the incentive fee at all? Or if they do, it's maybe like $12 or something like that. So I wondered if maybe you could talk a little bit more about that incentive fee and how much you just really don't see back.
Correct. It's a hit and miss for sure. Sometimes even with the same health plan that you bill, you may see the incentive fee come back, and sometimes it may come back in some patients and sometimes it may not. So that's definitely something that we've looked at, and we've compared both on the prescription processing side with the administration fee, because you're billing for the product. And then of course, that administration fee, and then a little later we'll talk about some consultation that goes alongside that. So there's really three things to be billing for, but that administration fee sometimes can be a lot smaller and not even existent. You want to make sure as a pharmacist, you're definitely compensated for the time that you're spending, preparing that vaccine, administering it. It's time that we want to make sure it's being captured in dollars.
Absolutely. And so one of the things that I would like for you guys to take away here today on this call is looking at that incentive fee and how many of your PBMs, whether that's a Part D plan or even a commercial plan for the PBM or for that pharmacy benefit, if you are not being able to capture that incentive fee, it's lost revenue. So how do we help you capture that revenue on the medical benefit? Now, whether that's through the Advantage policy for a Medicare patient or through, Angelina and I both are in Texas, so I'll give Texas Blue Shield as an example. Or if that is through a commercial plan like Texas Blue Shield, where their PBM might be Prime Therapeutics or Express Scripts, they may not pay the incentive fee as a commercial patient for a flu shot. Well, how do we capture that anyway? Or at least how do we try to get some of that reimbursement back? We bill to Texas Blue Cross as a medical claim for the administration. So the incentive fee and the administration code, same thing, but they call it different on the PBM side versus the medical, but you still want to try to capture that reimbursement. And that's where a system like DocStation can help with, you've already lost on the incentive fee for that commercial plan. Try to get that reimbursement on the administration through the medical benefit. And that's really kind of where some of these, again, hidden reimbursement or hidden value can come in, where you haven't been able to traditionally get that incentive fee through the PBM. Let's try to go get that through the medical benefit, because it is, to Angelina's point, it's still time that you're spending with that patient, and you should get that reimbursement value. The other thing, again, that isn't necessarily shown in this data, but I wanted to also see if, Angelina, you could talk maybe more about some at-home administration for your Medicare patients too. So whether you're going to an individual resident home or if you're going to a facility or something like that, how do you make sure that you're capitalizing on that at-home administration for those patients too?
So definitely, if you are visiting a patient at home, and I know many of our pharmacists do this, just because as pharmacists, we want to take care of the patient first. It's definitely something that we want to do, and it's priority on our mind. And so a lot of you are already doing this, not even billing for it. So definitely for your time, if you have a patient that's at home that you are visiting, that you're administering that vaccine or doing some, some other types of, long-acting injectable, something like that, you want to be able to capture that administration fee. Or if you're in a long-term care facility, that time and that administration, you definitely want to be able to bill for that. And there are certain codes, that you can use for billing. And that's part of this whole process with medical billing, being able to create that claim, to spend the time on the back end to capture the dollars that, reflective of the time that you're spending with the patient.
Yeah, and that's, I mean, depending, it'll vary, where you're at regionally, but typically for that at-home administration, that's at least an additional $38 to $40 that you tack on top of any of these vaccines here, right? So it is really important to make sure that you're capturing that additional revenue, being able to document that. One thing that I will say, and I typically say this to all of my pharmacies too, where if you're going into a facility, I know it's easy to call everybody into a cafeteria or, a control location. And I get that that's sometimes the best option, understand that. However, I would like you to consider being able to visit each individual room. You are able to bill for more at-home codes in a given day if you administer directly into their home, or excuse me, into their room. So, apartment 4A or, 212B, whatever the case is, if you go into each individual apartment, you do have the ability to bill for more of those at-home codes in that given day. Whereas if you call them into a group, it is a lower volume that you're able to bill for in a single day. So something to consider, things to make sure that you're aware of during this upcoming vaccine season for sure. And I do see some questions coming into the chat, so that's great. And I know one of our moderators, Max, is in here also answering some questions. So please feel free, go ahead, keep popping in questions into the chat. That's great. We've got a couple of moderators. And if you haven't had a chance yet, there are some poll questions that have come out. So if you want to, go ahead and pop in some answers into those poll questions as well. But we're going to go ahead and go on to looking at this H section within the SHOT method. So being able to harness the medical benefit advantage. Now, we've already talked about the higher reimbursement rates. So I've kind of shown you what those volumes look like. We've talked about the incentive fee. I would love, Angelina, for you to kind of expand on this last box here, clinical services scope expansion. And we kind of break down to give everybody here kind of the idea of what this means. But being able to bill for additional clinical services, such as a vaccine assessment or any other sort of time that you're spending with that patient that is outside the norm of a clinic, right? You're not going to have the ability to spend 15 minutes with patients that are coming in 100 at a time for a clinic. So this is looking at additional clinical services that you now have the opportunity to bill for as a medical claim. So I'd love, Angelina, if you can maybe expand a little bit on your process with billing for clinical services as it pertains to some vaccine assessments.
Yes, definitely, Rachel. And so this is where I do spend a lot of my time in clinical services. With Best Value Pharmacies, I'm the clinical director for our stores, and then also in my capacity as managing network facilitator for CPS in Texas. A lot of what we do is with medical billing. And, of course, it's going to vary by state. So it depends on your provider status. It depends on the laws within, your state. But I can tell you that in addition, and as we alluded to before, and as Max is putting in the chat as well, you can, in some states, be able to bill for that consultation that you have with the patient. You're already there, the patient's already in front of you. You're giving that vaccine. You're probably already talking about the grandkids. You're probably already talking about their vacation. You know that patient, right? So we're utilizing that time and space that we are in contact with the patient to be able to do what we call vaccine screenings. So as pharmacists, we give the patient that VAR sheet to fill out, and there are certain questions. Are you sick today? Are you pregnant, right? All those standard questions that we're asking. We also slip in another paper that's vaccine screening. So asking them, have you had the CDC recommended shots for your particular age group, if it's over 65, under 65, if they need a pneumonia or a shingles shot, or if they're a younger individual and need an HPV, whatever the case may be, we're putting it on there and we're having them check it off. And then when we're in the vaccine room with them, we're doing that consultation. We're educating them on the importance of vaccines. We're educating them on the need for it, and perhaps either giving it to them right there if they didn't get it, or scheduling them for another visit to come in. So if you think about a patient that's over 65, that's a huge, total reduction in cost of overall healthcare to be able to administer a preventable vaccine to that patient And so being able to bill for that consultation time that you're already spending with them, it's a no-brainer. It really is. And so as part of our medical billing program, we are definitely capturing that screening, that workflow process, because, you know, it's not going to happen in the pharmacy unless it's incorporated in the workflow, unless you have a special person, you know, put aside, a clinical pharmacist put aside to be able to do that, which in some cases that could be a scenario, depends on, you know, your store and what's the capacity. But definitely being able to take a process that's already in play in your pharmacy and then slip in a sheet where you can do that consultation and be able to bill fit is definitely golden.
That low-hanging fruit, you know, again, like you said, they're already in front of you. You already know everything about that patient. It is now the ability to, one, capture that time. You document that. Obviously, documentation is super important when you're going through anything clinical, but then have the ability to bill for that encounter, right? And again, having the platform that allows you to do that. Now, it is going to vary state to state, like Angelina said, but just being able to have the ability to know that you have a platform that allows you to bill not only for the product and the administration of that product, but what about all the extra counseling? What about all the extra consultations that you give in the same visit? You can now have a platform that allows you to capitalize on all of that in a single go, right? So it's definitely beneficial to be able to capture all of that at the same time.
I do think as well, Rachel, I mean, we're talking about vaccine screening, but if the patient is in front of you and you're reviewing their medical history, and if your state can do tobacco cessation counseling, contraceptive counseling, or whatever the case may be, you can use that time that they're already in front of you to talk about additional things or whatever it is that you can bill for in your state under your scope of practice. And then, as Rachel said, the documentation is super important. Being able to create that SOAP note, you know, put it in, or even if it's an e-care plan, you know, for CPS and pharmacies, being able to document that e-care plan and submit that out would be essential. So definitely capitalizing on that time. That's definitely a low-hanging fruit. And it's a perfect time, especially with flu season coming up in a couple months.
Right, they're already in front of you. So be able to capitalize on it. Yes, absolutely. I think that's super beneficial. Thanks for chiming in on that one. So again, kind of circling back to this idea of vaccine billing and where's that additional revenue coming from. This is where now you have the opportunity to say, okay, we know what DocStation is promoting, right? We know being able to see that claim come through, you built a Medicare Part B, you get that rejection, you know it's going to have an Advantage plan. Well, now what do we do, right? So how do we take that concept and really make it a reality? How are we going to be able to help the pharmacy see this is your Advantage policy and this is how you do this? This is how you submit to the Advantage policy as a medical claim. And then at the same time, if you have the capability to be able to include a consultation at the same time, how do we do all of this? How do we incorporate all of that? Super important there as well. I do want you guys to know that with the DocStation platform, one of the things that we are able to help you do is identify what that medical Advantage plan should be. So we are running that eligibility at point of sale. We are telling you what that Advantage policy is, whether that's Aetna, Cigna, Blue Cross, United. We're going to tell you what that Advantage policy is, and we're going to tell you how to bill to that Advantage policy, to DocStation Spin, through your dispensing software. So that's how kind of the process or the workflow, I guess I want you guys to keep in mind. And again, if it's something different than you're used to, it is something that I want you really to start thinking about, just the sheer benefits of being able to bill to that medical plan. When for so long, yes, you might have been billing to that PBM, but I really want you to start shifting your mindset and getting into this idea of billing that vaccine to the medical benefit for higher reimbursement. And that's kind of what we want to be able to hone in on for you guys as well. All right. So we're going to move on from our SRH. We're going to go to O, optimizing your submission process. Now, how does DocStation help you do this, and what does that workflow look like to integrate into your pharmacy? So one of the things that is extremely important is that EDI enrollment process. Now, what is EDI enrollment? What are all the things that go into this? One of the things that DocStation really works hard on is being able to track those claims. So when you are submitting claims, one of the things I want you to think about is how many times have you submitted a claim and hope that it gets paid? where maybe you're submitting through a different platform and you have no idea if that vaccine actually got paid or not. And no matter if it's to Med Part B or if it's an Advantage policy, you need to have a platform that allows you to understand what you're getting paid. And that is this EDI enrollment process. And I know with Angelina's experience with CPSN and her pharmacies through that organization as well, just how important EDI processing is. And what this allows DocStation to do is be able to get the ERAs, or that electronic remit, from your claims and post it back into DocStation for you to see. So if you're submitting to Medicare B, if you're submitting to Aetna, if you're submitting to Cigna, Humana, Blue Cross, WellMed, whatever the case is, you need to be able to have a singular platform that allows you to see all of those claims. So you don't need to go to this platform or this portal to see, a United claim, or Novitas to be able to see a Medicare claim, or download remits. I've talked to so many pharmacies that are manually downloading remits to be able to see their EOBs and see what they've gotten paid. So one of the things that DocStation will take on for you is this process of the EDI enrollments, and making sure that any payer that you submit a claim to, whether that's a vaccine or a consultation or a clinical service, we want to be able to help you track that claim to ensure that you get paid for that claim. Now, as far as workflow integration goes, Angelina, I'd love to kind of maybe have your perspective on, when you come across a new payer, right? When you've got Aetna come across your screen, or you've got a patient that's a Cigna patient, what does that process, maybe kind of think back to when you first joined DocStation and really understanding how important EDIs are, or those ERA enrollments? What's kind of your experience on maybe one, communicating back with DocStation, but two, just how important it is to make sure that your staff understands tracking those claims and applying for the new ERAs, things like that. So maybe kind of give us some of the pharmacy perspective on just the EDI process and tracking there.
Yeah, absolutely. I mean, it's not only DocStation. Any medical billing platform that you're currently with or deciding to go with, EDI enrollments is important, because you have to be able, to know the profitability of your business, to understand what are the dollars coming in, and if the dollars are coming in that check form, or if it's coming in by mail, or if it's coming in direct deposit. All of those things you need to be able to track, and you're not going to be able to track that unless you have those enrollments already done. So it was nice that we had that done for us. Now, it does take some time, obviously, to get that done and to get it approved. But in the beginning, we really weren't able to track whether we had any dollars paid or not. We had to go onto maybe the specific Cigna portal, or the specific United Healthcare portal, or whatever it may be, or through another, Availity, or wherever the case may be, to kind of track that down. And that can be a little bit of a nightmare, especially if it's the pharmacist doing it, which, again, I talked about in the past, optimizing the role of non-pharmacist support staff. We have a whole program in CPSN just kind of devoted to that. All these different roles that you can, free up the time of the pharmacist to be able to do cognitive skills and clinical skills, and spend the time where the money is, but then have your other staff be able to support that. So having these EDI enrollments is, it's going to take some time in the beginning, maybe 4 weeks, 6 weeks, depending. But once that's in, we had a pharmacy technician go in the background, be able to, specifically with DocStation, they've got some really nice filters that we'd be able to filter what was paid, what is rejected, what's our invalids, what's the different statuses, and then be able to work through that and understand where those payments are coming from, where they're going, and making sure that's reconciled to what's in our bank account. So that in itself is a process, but it's absolutely necessary, right? It's what you do for prescription processing as well. You've got to check on the dollars on the back end. So having that enrollment is essential, it's important, and it allows you to be able to track on the back end.
Awesome. So yes, it's definitely essential. And I think maybe something that I'd like for those of you that are, maybe this is a brand new concept, listening to us talk here today about medical billing and for vaccines in particular. But one of the things that I want you to take away from this message today is that you are seen as a medical provider. And as a medical provider, submitting medical claims, this process is absolutely necessary. Being able to capture that patient's medical plan information, being able to submit to the medical benefit, and now treating yourself as a medical provider. You're not just dispensing medication. You are a medical provider, and your practice needs to reflect that. So the process of maybe adopting a new workflow, like Angelina is suggesting, having somebody on your team that can help you with this process. When you go into your primary care, it is not the doctors doing any of the billing or any of the registration for patients or looking up benefits and anything like that. So I want you to really take away a message from today that you are a medical practice. Now, the services that you're providing to these patients and you're billing for, they're medical services, whether it's a vaccine administration or a consultation, right? So these are all things that I want you to be able to take away. And then please come ask questions. What that looks like as far as workflow within your pharmacy, how do I train my staff, who can I help or ask for help, things like that. So I definitely want to make sure that you guys know you can reach out, you can contact us to kind of see what that might look like for your pharmacy too. And then this kind of leads us really well into being able to track those reimbursements. So we've already talked about why EDIs or what they are and why that's important. But one of the things that I want you to recognize and see within DocStation is that you have the capability, I kind of mentioned this or alluded to it earlier, but you have the capability to see any patient, any claim, any payer, any product, any service. And so being able to have a platform that will track and help you maximize that reimbursement, you can see exactly what claims are getting paid. You can match up and see exactly which payers are paying for what. I think I have Mary on here from Meyer Pharmacy in Iowa, and being able to really dive into the different levels of reimbursement for your payers. So I'll give you a great example where Mary, from Meyer Pharmacy, I know I'm calling her out today, but we talked earlier, so hopefully she's okay with it. But Mary was able to see the reimbursement that she's getting on the PBM side from Optum and compare that, there's Mary, and then compare that to what she's getting on the reimbursement side for the medical plan, which is United Healthcare. Now, how do we make sure that we can get the most reimbursement out of United Healthcare to make sure that to maximize, again, that reimbursement value for your vaccines? And so Mary's done a lot of research, and we were able to kind of take a look at the differences there and how she's able to bill to the medical benefit and get higher reimbursement on the medical benefit to United versus Optum. And so all of these things, yes, they do take time, they do take effort, but I promise you the return there is definitely worth it. But being able to have a platform that allows you to submit those claims and then be able to track that all the way through is really important. It really does add value. You can see everything that you're doing, everything that your staff is doing, and be able to be really proactive about all of those claims. And so and I'm going to pull Angelina back into this as well, but I think maybe it would be really great to hear, Angelina, from your perspective of just all the different payers that you're submitting to, and having that singular platform to be able to see and track those claim submissions and monitoring that. I know, again, you've got a good staff that's helping you do that, but I think something to kind of make sure that thanks, Tracy. If you guys can read Tracy's comment, 100% bill UHC for vaccine over Optum. But one of the things I'd love for Angelina, if you could comment on, is the ability within DocStation's platform to see all of your payers for any vaccine or product or clinical service. But how do you kind of maintain and be proactive about all of those claims using DocStation's platform?
So definitely it's nice to have everything centralized. As pharmacists, we're trying to limit the number of platforms that we have, and having things that are integrated is definitely preferred. You don't want to have to leave what we're doing to go to 3 and 4 different platforms and log into several different portals to see if we're getting paid and check eligibility and go back to another portal to check claims. And it gets really confusing, but at the same time, having to train that is also difficult for someone else. So having a process, whatever it is definitely essential, and being able to make it simple, step by step, so you can train and scale. Scaling is really important, right? You want to learn the process, you want to understand it, but in order to make it profitable, sustainable, scalable, it has to really be simplified. So simplicity is definitely what we're looking for, and easy to learn as well. So, I mean, it's not a secret. CPS and USA does have an agreement, and we partner with DocStation and other vendors to be able to understand the process, use the billing platform, be able to show others how to do it, train and teach. And many of the DocStation employees are excellent to be able to help on that with the platform, with their conversations that they have on the back end, where you can put in something in chat and then have a response fairly quickly. That's really important as a manager network facilitator, just even having that relationship with Rachel and the team to have meetings to be able to address issues for our pharmacies is really important. But yeah, it really is helpful having that one centralized place to be able to track all of the different claims from all the different payers, clinical and vaccine as well. Obviously, being credentialed in many different payers is important, making sure that you are contracted, you are credentialed, and then having those EDRs. So it's a process, right?
Yeah.
There are many different pieces. It can be very confusing. So it's important to have experts in the area that can help support you, that can coach you, that can handhold you through this process. It's very much, I like to say, teaching you how to fish, especially if you don't know anything. So you can come into this process knowing absolutely nothing, and then kind of learn as you go along. And then as you learn the process, then you have wheels, then you have options, right? You can bill in several different ways. You can scale. You have more options essentially once you learn the process. But in the beginning, just understand it is a learning curve. It's something new that you probably haven't encountered before. It's a whole different ball game. Still a ball, but it's a different game with different rules, with terminology, with vernacular you haven't encountered before. But we're here to help you. Absolutely. We're here to coach you and hold you. We have the experts. I say we as, there's DocStation, there's CPSN, to be able to help you through this process. Absolutely.
Awesome. Thank you so much for that perspective. I think it is really important. I mean, obviously I'm in the pharmacy every day, so it is really important to have that perspective. And I've seen a couple of questions come through that I want to make sure that I can address for folks as well. I know we've got some moderators answering some questions too, but I want to make sure that when we look at vaccines in particular for Medicare Advantage, I had a pharmacist explain this really well to me recently. When we see claims going through to, let's say, United instead of Optum as an advantage policy. So I want to make that distinction pretty clear when we're looking at vaccines, the product and administration going through to the advantage policy. What we are seeing is that the pharmacy already has a contract with Medicare Part B, right? So I think about it like a triangle. You have a contract with Medicare Part B. Medicare Part B has a contract with the Advantage policy. And so by extension, you are able to bill to the Advantage policy for the vaccine product because it is a Medicare covered benefit and you are contracted with Medicare Part B. Now, if we're talking about clinical services and additional things that Angelina is also doing within her team, yes, it's going to be state specific. It's going to matter with what you're able to do in your state and within your scope and things like that. But I want to make sure that, the data that I posted earlier with that growth chart there, those are different plans across the country, whether that's, again, Medicare Part B, just straight B, or Humana, AARP, Aetna, Cigna as the Advantage policy. So those are being paid, being able to submit as a medical claim to the Advantage policy. So I just want to make sure I'm separating that and having that distinction there between a clinical service and credentialing and contracting for the clinical side piece there versus a vaccine. And so it's definitely something to consider when you're going through and submitting those claims for the product and admin, but if you needed to, be able to bill for any clinical services as well at the same time. I'd like to maybe focus a little bit on the tracking. This is kind of a screenshot here just to make sure that you guys all see, if you're new to DocStation, what that tracking actually looks like on the platform. But I'd like to talk a little bit about management within your pharmacy. How do you see this? How do you kind of incorporate this into your workflow? One of the things that I talk about with my pharmacies all the time is that you may not be in DocStation every day. And that's okay. You are going to be in your dispensing software every day, but you may not be in DocStation every day, but it is crucial to make sure that you are logging into a platform to be able to see your claims. It's your revenue. It is your claims. It's something that it is really important for you to be able to see and understand what's happening with your claims. So I'm posting a little bit of something to consider here, or an actual claim that's gone through, where you can see a vaccine, an administration code, and the at-home administration as well. All three of these codes can be submitted on the exact same claim through DocStation, and then go through for reimbursement to whether that's Medicare B or an Advantage policy, but be able to be paid as a medical claim, right? So having a platform, kind of like Angelina has said, where you can see every payer for any status, for any product, these are not real patients, right? Daisy Duck is not a real patient, so please take that with a grain of salt. But you're able to see anything that you're doing on your platform in one portal. So you don't have to go to multiple places. The tracking is there for you, making it super convenient as well. And then I want to talk a little bit more about what that implementation looks like, and I want to give us some extra minutes for questions as well. But what does this actually look like from start to finish within DocStation, being able to actually get up on the platform, start submitting, start training staff, submitting claims, and kind of what are those steps necessary to take? So when you sign up with DocStation, the very first thing that we are going to do as an implementation team is start those EDI enrollments. So we're going to collect all of your list of payers, whether that's Med B, Advantage policies, any commercial payers that you're going to submit to. We're going to collect all of that and immediately start those EDI applications for you. So we'll do that. We'll submit on our side to make sure that we can track all of those claims. We also want to make sure that we train anybody and everybody. It is really important that anyone that's going to, take part in DocStation, submitting claims, tracking claims, like Angelina said, having somebody to help you do this, it's really important. So we want to make sure that we can train everybody on the DocStation platform. And then making sure that we get those third parties set up in your dispensing software. So billing to DocStation's been for these vaccines, right? So being able to actually get this set up within your dispensing software, this can be done, again, by anybody who has access to your dispensing software, but we can add those and help you add those into your platform there. And then get started submitting your claims, right? So this is going to take, like Caitlin said, it does take a little bit of time to get those ERAs or those EDI enrollments authorized. You can start submitting claims to DocStation's bin. And the nice part is we can hold those claims until your EDIs are authorized, and then we can submit those claims, right? So if you have a lot of vaccines kind of waiting on that EDI process to be approved, that's okay. We want you, though, to make sure that you're familiar and comfortable with that platform, and that can happen extremely quickly. So you can get up on the platform really quickly. It doesn't take a whole lot of time. And then you're going to immediately start tracking those claims. So as soon as those claims go through and are submitted to the payer, you're able to see that process, whether that claim, goes through into a submitted status to your payer and then is able to get paid or denied or rejected or comes back as an invalid claim. All of those things you're able to see on DocStation's platform. And of course, that 30-day mark there is really what we're shooting for from start to finish when we want to see those claims be paid within that 30-day window. Now, of course, there are going to be claims that do take longer to adjudicate. We know. However, that's the goal there, is to get you up and going within a short period of time. And that's definitely realistic. It's feasible for some of these payers, right, to be able to get up and going and start submitting claims quickly. And that's the goal, to be able to see that quick turnaround time there. So I just wanted to kind of give you an idea of what that process could look like for you. Does it have to look exactly like this? No. But it is really good to get a visual on what that process could look like for you, especially with vaccine season almost here, right? 2 months, a month and a half, it's going to be here pretty quickly. So I wanted to give you guys a good realistic expectation there as well. But with that said, I wanted to give a couple minutes extra at the end here to make sure that we can go through additional questions that have come through. If you guys have anything specific, for Angelina about her process too, within workflow, within her pharmacy, love to see some of those come through. We had quite a few people on the call today, so feel free to pop into the chat center there. There is a question section too, so if you didn't want to post a question to the main chat group, there is just a question poll that you can submit as well. But we have a couple of moderators going through to answer questions, but I'd love it if we can spend maybe the next 5 minutes or so just being able to answer anything that comes through for you guys as well. I do see a couple here. Let's see. Lisa, that reimbursement rate for consultations, I hate this answer, but being transparent, it is going to vary payer to payer and even state to state, and really making sure that you kind of understand the scope within your state and what you're able to submit. But it does really vary payer to payer. I would say maybe average across the board for that 10-minute window consult time, you might be looking at somewhere between 25 to 45. I think 50 or more is kind of on the higher end, but that's maybe a good realistic range there to keep in mind. But again, it is going to vary state to state there. So it's a good question, and I get it all the time, but unfortunately, it is going to vary state to state there. Yeah, no problem, Lisa. So Daniel, let me kind of take a look here. Able to bill for 2 different vaccines and a consult within the same claim? Yes, you can. So if you're given a flu shot and a COVID shot on the same day and you want to bill it on the same claim, you certainly can. I do like to just put out the alternative there. As far as tracking goes, if you're going to combine that all into a single claim, it is more difficult to separate that as far as reimbursement and making sure that it's visible for you. So if you do see that on 2 different claims, it is a bit easier for you to understand, okay, this payer paid XYZ for COVID and they paid XYZ for flu, or hey, this payer didn't pay great on the administration code for flu, and they paid really well for COVID. So it is a bit easier to see it if you do separate those claims, but is it possible to combine? Short answer is yes, it's possible to combine, but I think for tracking and reimbursement purposes, it might be a little easier to see separated there. Sure, no problem. I think there's a couple more questions coming through as well. Yeah, so G2, I can go back to our, I'll put the slide back up here for you so you can see it as that comparison there for you. So this is data that we have internal that Max was kind enough to combine for us and be able to put in a viewable and shareable format. But this is the PBM versus the medical, and this is Part D plans, right? So this is looking at the Part D benefit for that Medicare Advantage policy on the prescription benefit versus the medical. And that medical reimbursement does combine, again, Medicare Part B, AARP, United, Humana, Cigna claims, things like Aetna claims, things like that. So it is a combination of any of those Advantage policies plus Medicare B as well. Ooh, Angelina, this would be a good question for you. How do you handle rejected claims after you've already administered a vaccine? So if you've administered a vaccine and then maybe let's say you get a denial or a claim that didn't pay for that vaccine.
So it depends. If we build it through the PBM, then we will be billing it through medical if it's rejected. And if we build it through medical and for whatever reason it's rejected, then we would bill it through PBM. Or, if, as Rachel mentioned earlier, if there's a Medicare Advantage or a dual or an additional plan that we did not bill previously, we're asking the patient if there's an additional insurance, or if there's that eligibility check that comes back from DocStation that there's a different payer, then we will bill to that payer. But again, it requires someone to see that rejection and someone to put that claim in, right? So having that person that is following and tracking your claims is super important, to be able to take that, whatever time frame, if it's 3-4 minutes, to step aside and be able to do that. So it's nice to have a designated person, even if it's 1 hour a week, that they're off the bench, that they're tracking this, because again, it's dollars on the table, right? That you want to capture.
Yeah, no, that's great. I love that feedback as well. Jesse, you're asking a great question. I actually had somebody else reach out about helping as well, and going through on the Advantage plans. And I'll be perfectly transparent without seeing, the actual codes that come back on the claim. But the information that we're able to understand for Hep B, being able to have the ordering or referring provider, that provider type needs to be very specific. So Medicare has some pretty steep requirements as far as what has to be submitted on that claim. So I would definitely want to make sure anything that's going through to the Advantage policy also mirrors that, because they'll closely follow or align with, whatever the Medicare policy is for those vaccines as well. We are coming up on time here. I know there were several questions that we didn't quite get to. And so I want to make sure you guys all know that the session is recorded as well. And we'll be able to send this out, but we do have a list of some of those questions that came through. And Jesse, I would love to maybe connect a little bit more for some research with you. I'd love to do that and try to troubleshoot with you further as well. But the questions that maybe we just didn't get to, we'll definitely take a look at and follow back up with you guys as well. But as a takeaway, you'll be able to schedule a call or anything that you would like to learn more from DocStation. We'd be more than happy to do that for you as well. But we are coming up on time here, and I don't want to cut off. So I really appreciate everybody today. Angelina, thank you so much for hopping on. This was great. And for everybody here that attended, I really do appreciate everybody here today. If we didn't get to your question, we will follow up with you because we do have those lists of questions saved. So we'll be reaching out as well. But if you have any other questions or would like to connect, please feel free to do so. You'll actually probably get directly in touch with me. That's my Calendly link as well that Kendall is popping in there into the session. So please feel free, take a look at that Calendly link. If you'd like to schedule more time with me, you are absolutely welcome to do so. I would certainly welcome that. I'd love to have the opportunity to talk to anybody and everybody here today to clarify any other questions that you have. So I really appreciate all the time today. If you have anything else, please feel free to reach out. Thank you so much, everybody.
Thank you, everyone.